right, we talked last time about the heart, the electrical system of the heart. Now we're going to talk about blood pressure. And your lab activity for this week discusses blood pressure and has you learn the method for taking a good blood pressure. And I also included some animations for you to practice with that. So blood pressure is just the force of the blood against the walls of the blood vessels, and because we know that pressure is highest in the arteries, we use arteries to measure blood pressure in patients that come in for a doctor's visit. So the device we wrap around the arm is called a sphygmomanometer. It's a pretty big word. You have to practice saying it a couple of times. Sphygmomanometer. So anyway, we typically wrap it around the upper arm. That's the brachial artery where we're measuring that pressure. So when we look at the pressure that is generated in the vessels with the heartbeat, we want to look at the systolic pressure, which is the higher number when the heart is contracting. That's when we would expect to see the highest pressure in an artery. And then when the heart is relaxing, that's when we see the lowest pressure. So typically 120 is the top number that in a normal adult. It can be as high as 129 and still be healthy, but we'd like to see it less than 130 for that top number, that systolic pressure. The diastolic pressure is the bottom number, and this is the lowest pressure in an artery, and that's when the ventricles are relaxing or not contracting, and that should be about 80 to 89 in a healthy adult. So when we look at blood pressure, you want your patient to be seated. You want them to be sitting for about 10 to 15 minutes. We don't want to take that blood pressure right when they walk in because they may have been rushing across the parking lot or climbing stairs or just feeling anxious about getting to the doctor. So we'd like them to sit down and relax for, maybe 10, 15, even 20 minutes. So this just gives us some numbers of blood pressures. So anything 130 to 139 is like a pre-hypertension, and then anything over 139 is high blood pressure or hypertension. Hyper means high, tension refers to pressure, so hypertension or high blood pressure. And then some people have normally low blood pressure, so if it's less than 120 to 110, that's normal and that's good. But when you get less than 110, that gets a little low, and less than 100 is definitely low. So people can have a normally low blood pressure and be between 100 and 110 for that top systolic number, and that's perfectly fine. Just when we get to be less than 100, that's a little on the low side. So looking at this device here, I'm going to just go to this real quick. I had a picture from your textbook up. Here we go. This is in your chapter 5, and this is the sphygmomanometer. So what we do is we inflate the cuff and squeeze it until we close off the artery. So we'll put a stethoscope right there on the brachial artery and listen. So you can see this tube is going up to her ears, or his, looks like a her based on the hand, going up to her ears, and she's listening for a tapping sound as she loosens the valve on the sphygmomanometer. So when it's quiet, there's no blood flowing through, and then as it partially opens, when there's a good pressure wave from the heart contracting, we're going to hear a little thumping sound. And that thumping or tapping sound that we hear through the stethoscope, that first time we hear that tapping sound, that's the pressure when the heart is contracting. So that's that top number. That's the systolic pressure. And then when that tapping sound goes away, we quickly record when that happened on the dial or on this bar here of mercury, which is pretty old-fashioned. We use a dial now. So when that dial is at the number, when that tapping sound disappears, we record that number, and that's when the artery is open and the heart is relaxed. There's no pressure wave. That's when the heart is relaxed. So systole is when the tapping sound begins, and that's the first number we record, and then diastole is when the tapping sound disappears, and that's the bottom number that we record. So it's important for everybody to know their blood pressure. So if you don't know your own blood pressure, I highly recommend you get it checked when you go to Walmart next time. It's not the best machine, but it gives you a general idea, and take it it's several different times throughout the day to really get a feel for what your average blood pressure is. So going back then, that's blood pressure, and your lab activity this week really goes into the details of blood pressure, and you'll learn a lot about that in that activity. So moving on then, working with the cardiovascular system is the lymphatic system. And the lymphatic system is simply kind of like a drainage system for the excess fluid that comes out of the capillaries to feed the tissues but is not used by the cells of the tissues. So instead it gets drained away by the lymphatic vessels, and they just pick up excess fluid that's been squeezed out of the capillaries and returns it back to the heart. So if we look at the fluid that leaks out of the blood vessels that's in between our cells is called lymph. So lymph is fluid that's in a lymphatic vessel that has leaked from the capillaries into the lymphatic vessels. So the fluid around our cells is called interstitial fluid. So interstitial fluid, we don't want that to build up and make our hands and feet all puffy. So we need vessels to drain away that excess fluid, and that's the job of the lymphatic system. So when we look at generalized functions, it returns that excess interstitial fluid back to the blood. It transports products of fat digestion in the small intestine. So there's lymphatic organs in our small intestines that helps break down fat and get it into the bloodstream. And then it also helps us fight disease because there's white blood cells in our lymph nodes that the lymph has to flow through before it gets back to the heart. And there in those lymph nodes are lots of white blood cells that can attack and clean up debris or bacteria that might have been in the tissues. So lymph nodes are found throughout the body, and their job is again to filter the lymph as it enters into those vessels in the capillaries. Nearby the capillaries are the lymph vessels, and the fluid flows into them and then through these lymph nodes, and there's macrophages and B cells and T cells that help fight infection. And maybe you've recognized when you've had an infection that you could feel some lymph nodes maybe swollen in your neck. Sometimes we feel swollen lymph nodes in the armpit or the groin. Those are common areas where lymph nodes can get swollen if there's a cut or infection in the body. Other lymph organs we have are the tonsils. Those are in the back of your throat. If you've ever had strep throat, you may have noticed swollen tonsils in the back of your throat. They can really be painful and interfere with swallowing, so it's always good to get those checked. The thymus gland sits on top of the heart, and that's an important lymph vessel that helps develop our T cells during childhood, but it turns to fat as we age, so it's not really a big vessel or a big organ later in life. It's more important during childhood when the immune system is developing. The spleen is an important lymph organ. It helps to store extra red blood cells. It helps fight infections. Peyer's patches are in the digestive tract, and the red bone marrow contains blood cells that are important for replacing, the red blood cells that die, because red blood cells only live between 60 to 90 days, maybe up to 120, but typically about 3 months. So here's a picture of the lymphatic system, and there's a nice picture or a diagram animation that I'd like to show you as well. So here's just an example of how we talked about the capillary beds branch, and my computer's acting up a little bit. So we have blood flow coming through the tissues. These are the tissue cells, the squares, and these are the nuclei of the tissue cells. So this could be the brain or muscle. We have blood cells flowing through, and notice the white blood cells are shown in purple and the red blood cells are shown in red. So there's no loss of those cells as it goes through the tissues. Those stay in the capillary, but we have a leakage of fluid out. We have high pressure on this end. This is the arterial end coming into the capillary bed. We have higher pressure here to force fluid out, but we have low pressure on this side to pull that fluid back in. So most of the fluid that leaves the capillary on the arterial end returns on the venule end, but we have about 3 liters a day that is filtered and enters the lymphatics. So here we can see the movement of these nutrients and ions and gases that are leaving. They're small enough to leave the capillary, or some diffuse right across that simple squamous epithelium. And then on the other side, there's a lower pressure that pulls that fluid back in, but the nutrients remain out in the tissues. So the fluid that comes back in is important because we don't want to lose all this fluid into our tissues and be swollen up with edema. Edema is the swelling that we see in our feet and hands when we're holding on to too much fluid. So that fluid comes back on the other end. So we have plenty of exchange occurring without a big loss of fluid. But again, we need to lose some of that fluid to filter it and enter our lymphatic vessels. And the lymphatic vessels here are shown, the little green vessels. They pick up the excess fluid from the tissues that doesn't return on the venule end. It enters these lymphatic systems, vessels. Just like in downtown La Crosse, the sewer system, when it rains too much, picks up the excess fluid and sends it back to the Mississippi so it doesn't flood the streets. It's the same thing with the lymphatic vessels. They pick up the excess fluid and they return it to the bloodstream. So if we look in our pictures again from your textbook, if we look at these, things that leave the blood vessel going from the arterial end, water, salts, amino acids, glucose, waste like carbon dioxide, those all are leaving the capillaries or entering it, and then the excesses of fluid, for example, would enter the lymphatics. So these are the lymphatic ducts kind of interwoven among the capillaries to pick up that excess fluid, carry it away from the capillary bed, and run it through a lymph node. So if we look a little further here, I'm just going to page forward. I guess we're going to be repeating here. So this picture is shown in your textbook on page 131. It shows the lymphatic vessels, it shows the lymph nodes. I have a better picture that's in color. Let's look at this one. So here we can see all the lymphatic vessels as it carries, again, that excess fluid that leaked out of the capillaries, carries it through these lymphatic vessels and through the lymph nodes. So you can see there's quite a few lymph nodes here in the hip or groin region, again in the armpit, and then again in the neck. So we can see there's a cluster of these vessels here. And when people have cancer, that's why that they can stage cancer as a stage 1, stage 2, B, 2A, etc., based on if cancer has spread. So if a tumor forms in the breast, for example, they also might find cancer cells in the nearby lymph nodes of the armpit. And oftentimes they'll remove the breast and the lymph nodes of the armpit, and then that causes a lot of swelling in the arm as a result, because the lymphatics are not intact to pick up that excess fluid and return it to the heart. So it ends up that they have a lot of swelling in that arm on the affected side. So you'll see them wearing like a brown sleeve on their arm to keep the blood flow, to keep the fluid in the capillaries and not as much leaking out, and relying on those lymphatics to drain that area. So these lymphatic vessels all lead to what's called the thoracic duct, which then empties into the subclavian vein. And the subclavian vein is right underneath the clavicle on both sides, and that's where the lymphatic fluid joins up with the veins, again the subclavian vein on the right and left, and then that fluid is back in the blood vessels again. So it's really a nice system for keeping our fluids in the blood vessels where they belong, and also giving the fluid that leaks out a chance to run through the lymph nodes to filter and get out any debris or infectious material. So if you cut your foot, for example, that fluid that leaks out into the tissue spaces with that cut is going to run through the lymphatic vessels, run through the lymph nodes, and filter out that bacteria and help that infection heal. So some people will find a little swelling in a lymph node if they have a cut, a little lower in that limb on the arm or leg. So the lymphatic system works with the cardiovascular system to pick up excess fluid and also help prevent infection and enhance our immune response. And that concludes the discussion of the cardiovascular system.